The boil water notice has now been lifted from the last areas affected by the cryptosporidium outbreak that affected areas of Higher Brixham and Kingsware. The public health action was led by the UK Health Security Agency, supported by ourselves in Torbay Council's Public Health Department. Now that we are past the acute phase of the public health response, which aimed to reduce the impacts of that contaminated water event so that we didn't have further cases resulting from people ingesting contaminated water, and also reducing the chances that those who were infected would pass it on to others. We still need to do further work to understand the full extent of those who were affected by the outbreak and to understand its impacts on local people. This work has been ongoing, and the UK Health Security Agency is now beginning a survey that will be directed at some of the residents in the affected area. I'm encouraging people who are asked to take part in this study. It's an online survey to fill out the questionnaire whether they were ill or not during the period. UKHSA is working with Southwest Water, and some people will get a letter which will have a link and a QR code to the online questionnaire. If Southwest Water has people's email and telephone number, they will also receive a link via email or and also via text message. The questionnaire will also be, we're also asking people to pass on that link to anyone who was staying with them between the 1st of April and the 15th of May, 2024. This is the period where we think the contamination event happened, and therefore be useful to ask people who were in the area during that period to also take part in the online survey and to complete the questionnaire. The questionnaire will take about 5 to 10 minutes, and the results will be used to help us to understand further what happened in this event, but also that there are important lessons that will apply to public health actions should a rare event like this occur again, not only here in the UK, but indeed anywhere in the world in future. The questionnaire will close on the 31st of July, 2024. And I'd like, on behalf of the UKHSA, to thank people in advance for completing that questionnaire so that we can get a full understanding of the impacts of this outbreak and learn valuable lessons that will add to public health research and help us in future responses. Thank you so very much.